But I wanted to address the fact that there's a reason that your doctor seems to not care about you. There's a reason that they seem to not really know enough about you, or ever remember certain things, or the list goes on and on and on. So basically, the way that traditional primary care works, if you use insurance to bill for your services as a doctor, you're kind of crunched on time. And that's because in order to make things work out financially to run a medical clinic, you kind of have to see upwards of 20 to 30, 35 patients a day, at least 4, if not 5 times a week per provider. And there's a whole bunch of jargon involved with that. It has to do with what insurance companies will reimburse you per visit. It definitely has to do with how complex that visit is. Doctors will tend to overbill because they think they deserve the same amount of money per visit no matter what. The list goes on and on and on. But it's really sad when, as a doctor, you feel forced to see upwards of 30 to 35 patients a day. Even when you're seeing 20 to 30 patients a day, that's sometimes considered a light load, but you still can't really get everything you need done in one day for 20 to 30 patients. What happens is you get rushed because of the amount of hours in the day, right? Not every doctor wants to be at the clinic from 8 a.m. to 5 p.m. just seeing patients, and then they go home and they don't have even time to breathe, let alone do the administrative work or write their notes about the patients. Some of them get really good at it. In fact, I'm actually pretty good at being really speedy and efficient and can get my notes done most days if I do that. You have to have a cadence with it and a preparedness and a way to focus. But the longer you do it, for some doctors, and I would argue most, the harder it becomes because you just get so tired. You get tired of being rushed through the visit. This is why you only see your doctor for 5 minutes for a 15-minute appointment, even though you think it's supposed to be 30 minutes or even longer. You're really scheduled in there for 15 minutes and you might be double booked with another person. So the doctor's rushing from room to room to room. They might only have 2 minutes to look at your chart and before they go in and see you. So they don't really have time to get to know you unless you've been seeing them every single time and you're seeing them at least 3 times a year. It's hard for them to remember you if you're not seeing them at least 3 times a year. So there's a whole rushed process to it. If they are lucky, they have 5 minutes to prepare to see you, 5 minutes to actually see you, and then 5 minutes to get the clinical note done and everything else that you need done, right? And so if they need to send a medication, it's more complicated if they have to send a controlled substance medication. We have to push data through an app that's a controlled substance app to either your phone or whatever software you use to get that data pushed through. And it's just extra steps along the way. Some electronic medical records are really complicated. So it's just click after click after click after click, making sure you have the right CPT codes, the right ICD codes, everything's lined up properly so that you can make that visit billable, right? So it's just frustrating. And, after you do this for several months, years, whatever, you just get really easily burned out from not having the time to spend with people to actually get things done, or not having the time to do medicine the way you want to do it. Okay, so in the process of burnout, you stop caring, right? So you stop caring about everything. Even though we all got into medicine, most of us got into medicine to care for our patients. At some point, if you're burned out and you're not taking care of yourself, you can't take care of anyone else either. You have no time to care about anyone else because nobody seems to care about you because you're overworked, right? So that's the problem. That's why I often get people coming up to me saying, well, you're really personable. You seem to actually care. Just having a side conversation, on my kid's football field or something like that, so I'd like to come see you. Great. I'd love that. But I also want to put it out there that there are other doctors like me that you can find people who have it down, but this is an argument for self-pay medicine in and of itself, because when you have a clinic that is not burdened by insurance billing, it takes so much pressure off of the doctor or the practitioner to run that 30 patient a day cycle, right? Prime Direct Health and the direct primary care model, we bill monthly. It's a low enough fee for people to not be breaking the bank, but it's enough for us to have however many patients we want to have, and keep the doors open and pay our bills, right? And so what that means for me, and everybody's different in the direct primary care world and the self-pay world, right? But for me, I'll see about 10, maybe 13 people a day. And I intentionally set my work hours kind of short, and I'm sure some of my patients don't like that, but at the same time, it allows me room to breathe. It allows me to take a little bit of work home, but not too much. And I actually argue that you shouldn't take your work home. So don't be like me. But I do a little bit just because I like being at home in general. So there's that. But if you have the time to see 10, 12, maybe even less, maybe even like 8 patients a day, you have room to breathe. You have time to sit down and listen to the patient. And it's that listening where you actually get things done, right? Because if I talk to you, even if I am just with you for 5 minutes, if I set my intentions and I come in the room not burned out and ready to focus on you, we can get so much done. I can learn so much about you, and I can just understand what's important to you. So it's of utmost importance to me to learn what's important to you, so that I don't practice medicine in a way that doesn't fit your style, right? So I guess I'm a little fluid that way, but a lot of self-pay doctors are, because we can be. So, and when you pay a membership or you do self-pay, we don't have to worry about, can I bill X amount for this office visit? Do I have to, bulk it up with this or that code? Do I need to make sure I do 2 things instead of 1 thing? But honestly, the opposite goes into that too. Like, I know that I can do whatever I want in that time that we have together. So even though in a traditional care setting, you might only can bill for 2 or 3 problems. And then after that, if you've ever been told like, that's another issue, you're going to have to come back for that. That's virtually not an issue for me as a self-pay doctor, primary care or direct primary care, because I've got at least a minimum of 30 minutes that I can spend with you. And we can get whatever you want to get done in that time. Some direct primary care medicine physicians will spend an entire hour with you if you need it. I'm a little too fast paced for that. I'm a little too ADD for that, but I think I get quite a lot done in 30 minutes at least. And so, really just sitting down, listening to you, trying to figure out what's important to you, and prioritizing what's most important to least important so that we can get things done. But there's really no limit to how many things you want to bring up, right? So bring it all up and let's chip away at it. And if I think that I want to spend more time with you and you can come back in 2 weeks or a month or however much time, just come do it. And you're not limited to like wondering, how much money you're going to spend, because how much money you're spending with a membership. It's, for us right now, it's $68 a month for an average person. It's a little bit different based on how old you are, but in general, how much you're paying. And we don't bill for office visits. We don't collect any sort of copay or additional fee for our time. That's the membership. So you might pay for a medication here or there, or a procedure here and there. But in general, what you're paying when you come see us. So that's my 2 cents about why you'll often encounter doctors who don't seem to care about you. It's not necessarily their fault, guys. It's a system that they're in, and they're just so tired. And so I would argue that you should find a doctor that has more space for you.